Welcome to KMET 1490 AM ABC News Radio and the Southern California Business Report with Yvette Walker, a show dedicated to highlighting successful Southern California businesses and the people behind them.
Welcome and thank you for joining Southern California Business Report on ABC News and Talks, KMET 1490 AM, 98.1 FM, and KMET TV. I'm Yvette Walker, live blasting our signal from the center of Southern California, serving a population of over 25 million. Get us crystal clear and on demand by downloading the free live streaming app on Google Play and the Apple App Store. As always, a huge shout out to the team, Mitch, Bill, and Sean. I love you guys, and to our special advisory committee, which can be found at www.scbrtalk.com/advisory committee. Check them out and learn all about these fabulous leaders in our region. All right, everybody, today I have the distinct honor to introduce Mr. John T. Chapman, the President and Chief Executive Officer at San Antonio Regional Hospital in Upland, California. Mr. Chapman joined the hospital as the Chief Operating Officer in 2018 and is currently the 7th President and CEO in the history of the hospital. San Antonio Regional Hospital has 363 beds, a staff of over 600 physicians, 2,400 employees, and 500 volunteers. The hospital offers advanced patient care throughout the Inland Empire. John is a clinical microbiologist by training and has served as an experienced hospital executive for over a decade. Prior to arriving at San Antonio, he served as Chief Operations Administrative Officer at Highland Hospital in Oakland, California. John was not only in charge of operations at this 169-bed general acute care hospital, but also led the clinical and support services for the Alameda Health System. Some of his accomplishments include Alameda's accreditation as a Level 1 trauma center, a baby-friendly designation, and the construction of a 9-story patient tower. Thank you so much for being with us today, Mr. Chapman.
Thanks, Yvette. It's nice to be here again with you.
Beautiful. So, as you know, my first question to all of my guests is please talk about your journey. What inspired you to now pursue and become the 7th CEO of San Antonio Regional Hospital?
Sure. Instead of boring you with too many details, I think I'd like to tie in kind of workforce and what we're doing to inspire children, because I went through the same thing when I was 17 or 18. I went through something in San Francisco called Enterprise. What Enterprise was, it was a way for students who knew nothing about healthcare to be able to partner and have a mentor for a summer of a physician. My physician's name was Dr. McInerney. I still remember him. He was a cardiovascular surgeon at Kaiser. I was able to see over 150 different cardiac surgeries. The first one was difficult, but I was able to stay on my feet after that. And why that's important is when we start talking about workforce development here in the Inland Empire, I'm so proud that we just started and just completed our first class doing the same thing. Students being able to watch operations, partnering with surgeons, partnering to see imaging, partnering with nurses. It's a hands-on approach to get our students interested in healthcare and staying here. So that was my plug for workforce development. Perfect. After I did that, I graduated from Cal and knew I wanted to be in healthcare and the sciences. So that's where the microbiology comes from. I'm a clinical microbiologist at the state. I ran service lines and the clinical labs at the University of California, San Francisco for 17 years. Have nothing but great things to say about UCSF. They paid for my further education in healthcare. As you said, ran Highland Hospital, which is the Trauma 1 center for all of Alameda County, and then found my way down here to beautiful San Antonio. So that's it in a nutshell, Yvette.
Beautiful. So we're talking about workforce, okay? We know that there is a shortage of over 40,000 nurses in California as it stands. Can you please talk about the state of our workforce in our region today?
Sure. COVID brought more than a virus. It brought the Great Resignation. And what the Great Resignation is many people or individuals, employees in healthcare decided this was too much stressful during those 2 or 3 years. They either retired, went to a different industry, or found jobs where it wasn't just as stressful. There's nurses, for instance, right, who decided to go out as travelers and go to different areas of the country, make a few more dollars, but have a say of what type of hospital, what type of surgery center, what type of hours that they wanted. But between resignations and nurses going elsewhere, I think I've seen statistics published where there's over close to 500,000 nurses that are going to be needed in addition to what there is today over the next 3 to 4 years. And it's just not nurses. We're seeing the same thing with family medicine practitioners, physicians such as anesthesiologists, radiologists, down to even EVS workers. And those are the environmental service workers who take care and do such a good job of keeping our facilities clean from infectious germs. So our goal here at San Antonio mimics the same goal for the state and the nation, in that we've got to find a way to introduce healthcare back to all levels of education, whether it be high school, all the way to medical school, right? And I'd be happy to share some of the things that we're doing at San Antonio to accomplish that.
Yes, please share what San Antonio Regional Hospital is doing to expand on workforce development in our region.
Sure. Why don't I start with nursing, since you brought that up first? We're so proud to have partnered with over 4 different nursing programs. And we invested probably over $7 million this year on training new grads. Most hospitals look for a registered nurse who has at least a year of experience. What we do, we brought in probably to date, over 180 RN new grads who need additional training. They partner up with an experienced nurse here, and they spend 3 to 4 months basically shadowing and working with that nurse. So we're investing in new grad programs from around the San Bernardino and Riverside counties. I don't think many people are doing that to that extent. In fact, when I talked at California Hospital Association or other venues, they still talk about shortage of nurses and the registry they use. We're so proud here at San Antonio that out of 3,000 employees, I'm only using 35 registry personnel. I've already filled our roles with nurses, and we're very proud of that. And you can imagine our experienced nurses on the floors are extremely happy that they have the help and are no longer burning out like they did between 2020 and 2022.
Beautiful. So has this always been the standard, this career development, or is this meant to accelerate the pathway into the career field of healthcare today?
Definitely an acceleration, Yvette, because we need it. Even with family medicine providers, who I mentioned earlier, did you know just in San Antonio, around our region, which is San Bernardino and Riverside, there's a dearth of over 100 primary care physicians. I can't tell you how many people use our 5 urgent care centers, and 40% of them don't have a primary care physician. Or if they do, there's another 20% that list a primary care physician. But then when you ask them, have they ever seen that person? No. So where are they getting their care? They're getting their care through urgent cares and going to ERs. We want to provide our community proactivity in terms of their health care by having the right amount of PCPs available to them when they need them. So in that regard, we opened up San Antonio Regional Medical Group. Our goal is to open up 7 to 9 family medicine primary care sites through our region in the next 2 years. We've just opened up one here in Upland next to the hospital. We're proud, you'll be the first to hear this, we're opening up our second side where we think it really is needed in Fontana. And our third site's going to be in Ontario in about 6 months. So we're well on our way to definitely enhancing the ability of those community members in our region to have additional PCP options.
Right. And I also see that the hospital has gone above and beyond by offering urgent care facilities to the community, right? So during the times when the emergency department is overwhelmed and, the patient is not suffering from a life-threatening injury, you have also rolled out urgent care facilities. Please talk about those.
Sure. We have 5 now. We'll probably have another 2 in the next 2 years. But when you think of care, right? Typically, people with chest pain or concern that something definitely is wrong, stroke, chest pain, they're going to go to an ED. But for those communities who may not have a solution like an urgent care in their area, they're also going to an emergency room. And that level of care is too high for them. It really is. I mean, I'm sure you or even my family have been in emergency rooms for 6 to 8 hours when it's not needed. They probably can go to an urgent care for 80% of their concerns, get them addressed appropriately in less than a half an hour. So it makes sense if there's a dearth of PCPs and EDs are getting too impacted, what's the middle ground? And that's urgent cares. And that's what we're offering at San Antonio for a good portion of our region.
Right. And my understanding is that patients that go to urgent care facilities, if there is a case where they do need that enhanced care, they basically go to the front of the line at the emergency department. Now, is that concept true, or is that just folklore?
Oh, no, it's true. Someone with a bloody toenail versus someone who's having chest pain. If I put that toenail first, I'm in trouble.
Let's not do that.
That's right. It's actually the first thing that you do when you come to the emergency room is it looks like you're checking in with a registration person, but right next to them is a physician. Not too many people or not too many ERs have a physician at triage that sees the patient, lays eyes on the patient within the first 5 minutes, right? So that's how we're able to prioritize patients. Most places do it with RNs who are good. They definitely have guidelines they go by, but it's better to have a physician up front, right? So that physician not only sees the patient within 5 minutes, while the patient's still in the waiting room, they're ordering imaging tests, lab tests, other diagnostic modalities that they think that patient needs for a workup. And God forbid, if the patient's having a heart attack or a stroke, they're wheeled in immediately and taken care of.
Right. And, I've been very blessed to experience that level of care myself with my own children. We've used the emergency department at San Antonio exclusively in over 2 decades. And boy, have you guys been ultra responsive and taken very, very good care of them. So going back to the career pathways, what are some ways for those that are interested in joining the field of healthcare to explore it and see if it's right for them?
Sure. I mentioned starting off the program, my experience as a high schooler, right? So we're doing the same for high schools in our area. We piloted with Upland High first, and we had a group of 12 really bright students be able to partner and actually see what healthcare providers do. So many times when you hear about high school programs, they really don't have that hands-on, one-on-one experience. They'll be a volunteer. They'll help with registration. They may be able to see how pharmacy works. They're basically away from true patient care. We decided we're going to offer something to our high school students where they're right in the front lines with the physicians, right? So we had three high school students who actually saw over 200 combined surgeries. And then when they're interviewed, we had a celebratory event to a person. They're saying, now I know my calling is healthcare. And we want to be able to expand that and offer that to all students. So that's at the high school level. So if you have those who are graduating high school and say, hey, God, I need a break from education, are they limited to learning about healthcare? No. They can come to San Antonio, take an entry-level job such as registration, that we talked about, or environmental services. And what we do there is if they stay for a year, we'll take a 3 to 4 week period and show them, hey, the next step up in education that you can get certification for, you don't necessarily have to do another 4 years of education, is areas that are still in need, like OR technicians or lab technicians, imaging technicians, which are different from technologists. And if they're interested, I've made an agreement, and you heard it here first, with the University of LaVerne, that I'll pay half their tuition and LaVerne will pay the other half.
Wow.
Right.
That is remarkable. So you are offering positions at the hospital, entry-level positions, to explore a career pathway in healthcare. And if people are interested in pursuing it, you are going to pay half of their tuition and the University of LaVerne is going to pay the other half. So no student debt for the person that is going to pursue this healthcare related field, which is number one, I'm sure, obviously job security, well paid, good benefits. I mean, really?
The idea is University of LaVerne is developing 7 or 8 programs for us. I mentioned a few: OR technician, lab technician. The other need is medical assistants, certified nursing assistants. They're part of it as well. And those are, I'm probably missing 1 or 2, but those are the programs they're developing for us. We're going to provide them, the students. And it's a win-win for the school, San Antonio Regional Hospital, and our community and those students. So, yeah. So that's at the high school level. We're doing the same thing, trying to have programs at the junior college level. We're even looking at a residency program for physicians at the medical school level. We have talks with 1 or 2 medical schools in our area to develop a residency program here at San Antonio, which will just enhance the wonderful quality scores we get now for our community.
Wow, that is remarkable. You mentioned that you're currently doing this with Upland High School. Do you have plans to expand this program to surrounding high schools, or what is your vision ultimately for this
Absolutely.
program?
Such a success that, you get beat up for success sometimes. You have several different high schools in our area saying, hey, we want to be part of that. Okay, you will be. But it does mean expanding the infrastructure to be able to provide it. But we expect to offer it to at least 4 or 5 different high school districts next summer.
Wow, that's amazing.
The shadowing program.
That is remarkable. And you mentioned that this year was the first year of graduates that had gone through the program.
Correct.
Oh my gosh, how exciting. So this is the year that it started. This is launching point. And from here, it's just going to grow exponentially, it sounds like.
We're hoping. I mean, coming to this community, what have we seen? We've seen our brightest and best actually leave our communities to go elsewhere for jobs. Our goal is to keep the best and brightest here, get them interested, at least with my bias, into the healthcare field, and keep them here.
Wow, that is amazing. And, being a part of the healthcare system is, I can't think of a greater role to society and service and just across the board quality of life, especially when you're talking about San Antonio Regional Hospital, which was recognized in 2021 and 2022 as America's 50 best cardiac surgery by Health Grades. Please talk about what that means.
Yeah, I mean, it's a pretty remarkable statistic for an independent hospital in the Inland Empire. It means exactly what you said. We have been recognized as a top 50 hospital. The question that should then come from that is, how do you become one? and they look at metrics. So morbidity, mortality, outcomes from cardiovascular surgery, the type of procedures we do. Are they standard, cutting edge? We compare to many academics in terms of what we do for cardiac cath-related procedures, valve replacements, to cabbages that our wonderful partners here in the hospital, like Synergy, that's the cardiovascular group, who definitely had a huge impact on these awards year after year after year. So we're very proud of the quality of providers that we've attracted and just the outstanding work that they're doing for our community. So really proud. So you'll definitely see that banner on front of our hospital, and there's more to come.
Beautiful. Yes, because during that time period, maybe you can share with us, was there an increase in heart attacks, cardiovascular issues that were connected to COVID? I would guess so, based on the news reports that we saw. So to gain that recognition in the thick of all of, everything that was happening at that time and the increase of cardiac events, how does your team feel about that? I mean, do you ever sit back to actually look at it all in perspective and relation to everything that was happening in the world, in the US at that time, and to be distinguished as the 50 best in the nation?
We do find time to celebrate, and then the nurses run right back into the OR. So, actually, just to put your question into sections. Are we seeing more cases of severity related to COVID? And I'd say directly and indirectly, right? So what I mean by that is indirectly, I'm sure your listeners have already seen and agreed that many people put their healthcare needs on hold, right? Whether it be screening tests, I have a little chest pain, maybe I should have that looked at. Well, I don't want to go in the ED right now. There's a COVID surge. Versus, hey, are there definitely some complexities from COVID? And there are. I'm not going to get into a vaccine discussion, but I am going to use it as an analogy. You hear of some individuals who have heart inflammation. There are some rare heart inflammation cases based on vaccination. And I had a friend who says, forget that. I'm not going to get a vaccination. I'd rather have COVID. What they don't know is COVID gives you that same heart inflammation at a higher frequency. So I tease my friend and I say, you're damned if you do, you're damned if you don't. But you're better off if you do in terms of taking care of yourself and protecting yourself against that pathogen.
So speaking of COVID, we've heard reports that there is a variant that is kind of coming up on us. What does that look like today, Mr. Chapman?
Oh, Lord. There's probably 42 different variants, but CDC and authorities get nervous on those that change their structure, right? Who significantly change their structure. I think every one of your listeners could get an idea of a spike ball, and that's what the COVID virus looks like. Well, those spikes are the ones that typically have changes to them. Those spikes are proteins. Proteins are made out of amino acids. So the current strain that they're worried about, I think it's B2 286, it has 30 amino acid changes on their spike protein. That's a lot. That's a lot. So the concern is, okay, if you have so many changes, are vaccines going to work, and will your immune system still recognize it, right? This person, just think of it, it's like a virus getting an extreme makeover. Am I still gonna recognize this virus? So that's always a concern. That's always in papers. And then they do their testing and they see, okay, how is the normal immune system responding to it? And okay, how are vaccine efficacy figures look for this new strain? So it's really not much difference than flu, right? If you think about flu, I hope your listeners know that it's a guess game on what variety or what changes influenza is going to have each year. And they base the vaccine on that estimate. Sometimes they're right on the money on the antigenic differences, and sometimes they're way off. So when you have those years, you have a flu vaccine and you find out it doesn't work, they're way off. Sometimes it does work and you have low levels of influenza in the community. Same thing's going to happen with COVID. It is happening with COVID.
All righty. Well, on that note, we're going to go to break. Everybody, Yvette Walker here with ABC News and Talk Southern California Business Report with John Chapman, President and CEO of San Antonio Regional Hospital, as he shares an update on the state of the hospital, as well as insight into workforce development efforts, the unveiling of the new Center for Aging with plans to address and tackle existing and future healthcare needs when we return.
Cal State San Bernardino is home to the only school of entrepreneurship in California. With globally ranked degree programs, you can start your journey today to become a successful entrepreneur. Learn more and connect at entre.csusb.edu.
Hi, Ray Lance from the Diamond Center in the Claremont Village here. One of the coolest parts of a third-generation family business is getting to know the families we serve through generations. Once you experience our friendly service, our fair and transparent pricing, and our beautiful jewelry that we make to last a lifetime, you'll stick with us too. Come visit us in the Claremont Village or at Lantz, L-A-N-T-Z, diamondcenter.com and see what makes us different.
Ontario International Airport is on to a better way to fly with over 65 daily nonstop flights to more than 20 major destinations and the easiest airport experience in Southern California. Visit flyonto.com/Ontario to learn more about Ontario International Airport today.
Hi, I'm San Bernardino County Sheriff Shannon Dykes. If you're looking to start an exciting career in law enforcement and make a difference in your community, we are hiring dispatchers, nurses, deputies, laterals, and many more. For a complete list of our jobs and more information, visit sheriffsjobs.com.
Hi, I'm Dana Rademacher with MGR Property Management.
A lot of people wonder about the value that property management has for their property. Property management can include all property types, including residential, commercial, and HOA. It is valuable because property managers are experienced in what can happen at your property. We're aware of liabilities. We're able to do predictive and preventative maintenance. We know what is coming up with the changes in the weather, the seasons, how old certain aspects or different capital projects at your property are. We're able to best negotiate contract pricing, legalities with your tenants, and anything else that you may need to ensure that you're getting the full value of your property.
If you're interested in speaking with the representative at MGR Property Management regarding your property management needs, you can visit our website at mgrrealestate.com, or you can call our number at area code 909-581-6600 to be connected with the representative.
The University of LaVerne is rated first in California for alumni satisfaction. Learn more about accelerated programs offered online and on campus in LaVerne, Irvine, Ontario, Burbank, or College of the Canyons. Visit go.laverne.edu. The University of LaVerne. go.laverne.edu.
Welcome back, everyone. Yvette Walker with ABC News and Talk Southern California Business Report with John Chapman, President and CEO of San Antonio Regional Hospital, as he shares an update on the state of the hospital, as well as insight into workforce development efforts, the unveiling of the new Center for Aging with plans to address and tackle existing and future healthcare needs. Thank you again for being with us today, Mr. Chapman.
Well, thank you, Yvette.
Beautiful. So prior to the break, we spoke about workforce development efforts, being recognized as a top 50 hospital for cardiac surgery. And of course, we touched on COVID a little bit. So thank you for that. I just love the recognition the hospital is getting. Like I said, I've treated there myself. My children have, and I'm a huge fan. I absolutely love the hospital, which is why I'm not surprised that in addition to being recognized as a top 50 hospital in the nation for cardiac surgery. You've also been recognized by U.S. News for 2023 to 2024 for high-performing hospitals in heart failure, kidney failure, and stroke. Please, again, talk about what that means for the region you serve and the patients.
Yeah, I think, Yvette, it all comes down to quality, right? You want not only to have a wonderful hospital in your area, you want it to be well known for quality. And we're so proud. If you look at the Medicare Star Report, Medicare Star Report is a report when a senior turns 65, Medicare will say, hey, pick a hospital that you think has good quality. Look at the CMS Star Reports. We're proud that San Antonio has the highest rating in all of San Bernardino and Riverside counties, including over many of our academic partners north and south of us. So that focus on quality also extends to what you were referring to. Some of the awards that we've received on stroke, we've received at least 7 different Women's Choice Awards for a variety of modalities. When I say modalities, you're talking about, OBGYN, heart care, surgery, etc. And we've been, as you are aware, we've been now in U.S. News and World Report as another high-functioning hospital in certain specific areas of healthcare. So we're real proud of those awards. Tell our staff, they tell our provider partners, and they definitely tell the story to the community that you're getting quality care brought to you in San Bernardino, Riverside counties by SARH.
Right. And so all of this obviously comes from the top, right? With how it is that these programs are implemented. But please talk about what it is that you have applied to make them distinguished. What methods, what practices, what philosophies have you implemented in order to become these or to receive these distinguished awards across the board?
Sure. I'll tell you a little bit about the infrastructure of San Antonio that may be different from other hospitals. Our directors, our nursing directors, our CNOs, they have day jobs. They're running operations, making sure our patients are cared for. But we actually have over 3 different teams: quality, performance improvement, and our community health improvement program, which does nothing but focuses on quality improvement at San Antonio Regional Hospital. So if you can imagine, if we're unhappy with a certain metric, say, I'll give you an example of one we worked on. We were working on, I don't know if you've heard of C. diff infections, right? C. diff infection is unfortunately a nosocomial infection, and nosocomial means you didn't come in the hospital with it. You got it at the hospital. And hospitals want to reduce that from happening. Symptoms of it is you really get bad GI upset, diarrhea, etc., while you're here for something completely different. Well, that's something we don't like seeing. So our rates were good, but we wanted to be great. We wanted to be a top 10 to 20% in the nation. So we've actually had a multimodality team. And what that means is it's not just somebody who has researched C. diff. You've got physicians, infectious disease doctors, nurses at the table, pharmacy at the table, microbiologists at the table on what can we do to continue have performance improvement, continuous performance improvement, CPI. And one of the outcomes we did is we invested in $3 million worth of, we call them UV robots. So besides environmental services cleaning a room after a patient leaves, we then put in this robot kills 98% of bacteria, viruses, molds that may be in a room. And not too many hospitals offer that. In fact, I think less than 20% have invested in that type of technology. So this is where, again, you want to be cutting edge that will improve those quality scores. And we've seen the C. diff rates one of the lowest in our region.
Wow, that is remarkable. Thank you for that update. All right. So as we know, equity, inclusion, and access in healthcare are very important themes and topics in our country today. Please talk about what you're doing in terms of expanding healthcare for those that are in most need, and tell us about your new Center of Aging.
Yeah, sure. So when you think of health, equity, diversity, inclusion, you think that one size doesn't fit all, right? Caring for a senior versus caring for a Gen Zer, or caring for someone who may live in an area where there's not many healthcare options versus a place where there's tons of healthcare options, all need different types and levels of care, right? So that are geared for them, right? It's almost like coming up with your own unique plan for that patient. What we're saying, and I think your listeners definitely could agree, in San Bernardino and Riverside counties, we're having a double-digit increase over the next 4 or 5 years in our Medicare senior population. And they have different problems than those who are in their 20s, 30s, 40s, 50s. So we want to come up with care solutions specific for seniors. And we're really proud of doing that. I have shared with you individually, we've just purchased the 165,000 square foot Mercury Insurance building in Rancho, and it's becoming a center of aging. What does that mean? Well, I'll use my personal experience. My mom, 86 years old, she is suffering from dementia. She can't get around. She's wheelchair bound. I'll say it. She's belongs to Kaiser up in Northern California. But does she have somebody besides a loved one, like my family members, to help her with her care, to organize her care, to make sure she's seeing the provider she needs? As we get older, we're going to be seeing more than one provider, right? And then I'm sure a number of your listeners would agree as well. Every time you're transporting someone who's wheelchair bound, even if they have Medicare, you're paying over $100 to $200 deductible every time they transport. So wouldn't it be nice to have a one-stop shop for senior care? And that's what our Center of Aging will be. We'll have physical therapy, speech therapy, occupational therapy, falls center. We'll have a pharmacy there. One thing that used to drive my mom crazy, no place to go get her hearing aid checked or repaired. That'll be there. A lot of people don't think about geriatric dentistry. How do you have a dentist who takes care of someone wheelchair bound? It's a special one. We'll have that. We'll have lab. We'll definitely have imaging earmarked towards those type of modalities that seniors need. And here's what I love. We told the physician community, and we have over 20 different medical groups wanting to move into the building. And they're all senior specific. So when you think of specialists, right, for the senior population, what do you think of? You think of urology, dermatology, definitely ophthalmology with eye issues as we get older, podiatry, right? You think of cardiology. So we'll have those types of specialties in this building, as well as geriatricians, family medical providers, and PCPs. So I think I'm including everything but the kitchen sink.
It sounds pretty comprehensive. So technically, an aging patient can go in and knock out, multiple appointments at one time and not have to go back and forth or traveling to multiple locations and multiple appointments, but having everything streamlined and offered in one center.
The thing I didn't mention is every clinician, medical group or ancillary that's in there will all be on a shared scheduling system. So we can have that senior, your mom, your dad, come for 4 or 5 appointments. We're holding their hand through it. with our case managers who are there taking care of the scheduling. And it just makes it much more efficient, hopefully much more easier for our seniors and their loved ones to see that their seniors are getting the proper care.
Wow, that shared calendar system, that is the magic part of this, all right, to be able to truly streamline and enhance that level of care. Incredible. So please talk about when the concept was developed, because you have been the CEO of San Antonio since 2018, and here we are in 2023, and now you have the building, you have 20 physician groups now here ready to go, and it sounds like you're not too far from opening it up to the community. Please talk about that process a little bit.
Yeah, so the idea came from performing a community health needs assessment. We partnered with you might have heard of the Inland Empire Health Plan. It's the managed Medi-Cal plan in the area. And what that does, it goes by zip code and figures out what does that community need by down to zip code of where perhaps care scores are suboptimal. And it also informs us of what's coming in the future in terms of types of groups, right? Whether there's a shift in age like we've seen, or if there's a shift in ethnicities, a shift in other type of what I'll call modalities on patients that, more women, more men, more children, that kind of thing. And then we try to figure out what will have the biggest bang for the buck for people in our community. Seniors was hands down number one. The other one we experienced, I think I mentioned on a previous show, in Ontario, we saw a large number of Latinx community members getting sick with COVID, right? They didn't know if they needed to be admitted or do they just need Paxlovid, because there's nowhere for them to go or not enough resources for them to go to Ontario. That's why we just invested and opened up our Ontario urgent care site on Mountain, past the 10 in Ontario. Mayor Paul Leon was very nice. He said, "Can you get down here and help us?" And we did. And Mayor Aquanetta in Fontana, she's saying the same thing with primary care, and that's why we're opening up our second site there.
Beautiful. And so what stage is the Center of Aging in? When can, the community start to book their appointments, get the care that they need? And
if I had my way, it'd be tomorrow. But honestly, with the build for that, because you're building new clinics for each one, it'll be over time. It won't be a big bang, but they'll be able to get some of their care that we talked about within the next 12 to 18 months. And then I'd say by the 24-month mark, we should be completely open and filled.
That is remarkable. That is exciting. So please talk about new efforts at San Antonio Regional Hospital.
Yeah, sure. So, when you talk about quality and our community, one of the tenets that I'm sure you're aware of is the 80-20 rule, right? 20% of our patients take up 80% of the medical care that's needed. So how do you identify those patients? There's a few ways to do it. Those who are readmitted within 30 days after being an inpatient at San Antonio, or as you mentioned, we call them the frequent flyers in the emergency room. Those people who have multiple visits into the ER. I'm sure they have many different comorbidities, and my guess is not a primary care physician. So we opened up a special clinic here, very large clinic next to the hospital. It's our readmissions clinic. So for those people who are at high risk for inpatient readmission, I'll give some examples. Those who have had pneumonia and have high risk for it reoccurring. For those who have uncontrolled diabetes, who may have come in. And more importantly, what we see a lot of is congestive heart failure, right? They go to the hospital, we get them better, then we give them discharge instructions, and we say, follow up with your PCP within 7 days. But what did I just tell you, Yvette?
There's a PCP shortage. Yes.
So they end up coming back to the hospital. So what we say now is follow up with your PCP. But if you can't get in within 7 days, here's the appointment date and time for you to come to our readmissions clinic, and our providers will see you there.
Now, that's the Care for You clinic, correct?
Correct. Yeah. Very good. And what we've seen is those who do not see their PCP within 7 days, the readmission rate was 32%. For those who have come to our readmission Care for You clinic, want to take a guess? It's down to 12%.
Wow.
Right. So this is saving a life. This is saving a ton of pain, morbidity, being back in the hospital. And the same goes with the frequent flyers we see in our ED. There's a variety of reasons for it, including many that are behavioral, and those are tough to tackle for our county and us. But those same patients are able to come to our Care for You clinic.
So how can the community best support the hospital's growing efforts and trajectory?
Spread the word. Tell your loved ones when you have a daughter or a son who are in the ED, they got good care. This is where we can go. Those who have a good experience at urgent care and understand the value of an urgent care, this is where you can go. If you're having chest pain, don't play around. Get to San Antonio. Our statistics show that our morbidity or mortality are lower than many, like I said, of the Loma Lindas and Cedar Sinai's in the area. Time is life. So don't think that being a regional hospital is a step down from going 30 miles to an academic when you're having chest pain, right?
Right.
And you'll be well taken care of.
Absolutely. And so also, what advice would you give to anyone looking to enter the field of healthcare?
Definitely explore. Get into San Antonio as an example. Find programs that you're interested in. Volunteer. You don't have to necessarily be a volunteer within the hospital, but you can volunteer. Like we have a huge volunteer program for our high schoolers, right? Where we train high schoolers and others on something, on a variety of topics. I think the last one we had was dealing with suicide prevention. What do you do when someone's telling you that they want to commit suicide? And we train high schoolers, et cetera, on how to handle that and then get the help they need. So talk to those in the healthcare field. Come to career days. Check, as I said, like the University of LaVerne or Chafee on some of the programs that they have for healthcare. Explore. How are you going to know what it's like unless you actually explore it, right?
Right.
Our goal is to enthusiastically suggest and influence you to explore those, such as the shadowing program we have for high school students.
Beautiful. And please talk about what you're most excited about as you look at the next 5 years at San Antonio Regional Hospital.
Just the growth. I mean, we want to put the community first, right? We're not a public health agency, but we want to partner with collaborators like behavioral health in San Bernardino and Riverside County. We want to partner with the Medi-Cal managed care program to find the resources. So 5 years from now, we can look at community statistics on death and morbidity and what are they suffering from in terms of healthcare issues, and see a drastic improvement in those rates. There's actually every year that comes out, the healthiest communities, right? Our goal is to get the cities and around our area into that top 10, top 15 percentile. Then we feel it's a job well done.
Wow, that's remarkable. Well, thank you so much for your time. Thank you for your update. Thank you for your hard work, your vision, and your dedication to deliver this incredibly efficient, streamlined, and well thought out healthcare system for our region.
You're welcome. We've got a lot of great people working here, and the best ideas are the people on the front lines. My goal is just to remove the obstacles.
Perfect. Well, you're doing a great job. Thank you so much for being with us today, Mr. Chapman. I look forward to future updates with you.
Thanks, Yvette.
Beautiful. All right, everybody listening, don't forget to find us on Facebook, YouTube, LinkedIn, and Instagram. Check us out on scbrtalk.com. Again, everybody, our hearts are with Maui. Families, businesses, critical infrastructure has been devastated. District Governor Mark Merriam of Rotary District 5000 is appealing and coordinating efforts to help those in need. Please visit www.facebook.com/Rotary Clubs of Maui for more information and ways you can help. Also, calling all soccer players. If you're 18 and over, mark your calendar. Now's your chance to make your dream of becoming an Empire Striker come true through 2 rounds of tryouts. The first one is gone, but weekend 2 is still ahead. Saturday, October 7th from 2 to 5 p.m. and Sunday, October 8th from 10 a.m. to 1 p.m. The tryout venue is Shui Family YMCA, located at 1150 East Foothill Boulevard in Upland, California. Tryout registration cost is $100. Visit theempirestrikers.com for more information. Don't miss my interview with Sheriff Shannon Dykes, who was raised in a law enforcement family and has lived in San Bernardino County for over 40 years. In high school, he was a Sheriff's Explorer Scout, and after graduating, he enlisted in the United States Army and was assigned to the 101st Airborne Division, where he served as a military police officer at Fort Campbell, Kentucky, and in Sinai, Egypt. Sheriff Dykes has held a position at every rank in the San Bernardino County Sheriff's Department, and his past assignments include corrections and patrol in Barstow, Apple Valley, Victorville City, and Victor Valley stations. Next week, we will have Gregory Bradbard, President of the Hope Through Housing Foundation and National Corps Senior Vice President of External Affairs, who has more than 20 years of experience as a community leader and fundraiser throughout Southern California. Prior to joining Hope Through Housing and National Corps, Greg served as President and Chief Executive Officer of the Inland Empire United Way. Under his leadership, the IEUW increased its community impact by launching several new programs to improve youth and family self-sufficiency. Greg holds a BA in psychology and social behavior from UC Irvine, and his past roles have included serving as the executive director for court-appointed special advocates of Orange County, executive director for the Irvine Public Schools Foundations, and director of development for Families Forward. You do not want to miss it. We'll see you all next week.
This has been the Southern California Business Report with Yvette Walker on KMET 14.